guys, my name is Tiffany and I'm a NICU nurse and I love educating about the NICU. This little mini series called the Itty Bitty Basics, I'm going to be sharing you some basic information about the NICU. In this video I'm going to be talking about some spinal defects. And the most common reason why a baby would get spinal defects is just genetics and it's probably passed down. Another common reason is not having enough folic acid. So it's important for moms, especially during prenatal care, to take folic acid every single day. One of the most common spinal defects is called spina bifida, where there's a small gap in the spine, but there's no opening or sac. Another common one is called a meningocele. Basically, the spinal cord and the backbone does not close fully, and so there's actually a sac on the baby's back, but it actually does not contain CSF or spinal cord. And lastly, the myelomeningocele, which is basically where the backbone and the spine does not close fully. And so there's actually a sac in the baby's back, but in the sac, it actually contains CSF fluid and spinal cord. So typical treatment for this is usually surgically, just depending on the severity of the spinal defect. So if there is a myelomeningocele, typically we would want to go to surgery pretty quickly on. And some nursing treatments that we typically do as NICU nurses is that we want to make sure to keep the baby prone. So we want the babies actually on their bellies when they're laying down. And then we actually want to keep the sac, if there is any, moist. Prevent any sort of evaporation, dehydration, and so we want to make sure to keep the sac moist. And so typically what we would do is we would grab sterile water with some gauze, and we would soak that gauze completely wet, and we put that on the sac and maintain moisture on the sac. Let me know what else you want to learn in this mini series.